Michelle, I'm so happy to be here with you today. I think as an ovarian cancer survivor, you have so much to share with your experience that could help other women, and especially discussing how you presented with ovarian cancer, some of the symptoms or signs that you had. If you could share that with people, I think that could be really important so that they can learn how to identify these important symptoms.
Oh, absolutely. And again, thanks for having me here today. I'm glad to be here. I was first diagnosed October 13th, 2014. At the time, I was working for a catering company, and I was doing a big event one morning, and I don't know if you've ever seen the coffee urns. They could weigh up to 25 pounds. I was lifting the coffee urn, and I injured myself. I ended up going to the emergency room, and 12 hours later, I found out I had a ventral hernia and ovarian cancer. I was shocked, completely shocked. I did have signs and symptoms of ovarian cancer. I thought I had IBS. I was told I had IBS. So for the better part of 2014, I spent not feeling quite up to par. The symptoms that I had masked the symptoms of IBS. I had bloat, I had diarrhea, feeling the fullness, just wasn't really feeling well for a better part of a year.
Right, so we're talking about 10 months that you had these gastrointestinal symptoms.
At least, probably even more than 10 months. I'm saying it was probably a year and a half at least.
And that's what I remember you telling me as well when I first met you. And I actually don't think it was the first meeting that you relayed that. It was maybe the second meeting that you said, you know, I've been feeling badly for a while. And you did seek care, but you also didn't push things further because you had so much else going on in your life, with family and work, and trying to put all that first.
I did, and that's the thing when you're so busy working and living your life. I was working 60 hours a week and taking care of my mom. She was sick.
So your story is so common. You know, a lot of women have those same types of symptoms you did. And so I would urge anybody out there that has 2 to 3 weeks of persistent daily issues with abdominal bloating, swelling, nausea, vomiting, a change in their stool habits that just doesn't seem right.
That was all me.
And also feeling that they have to go to the bathroom all the time, so increased urinary frequency, pelvic pressure, or pelvic pain. If you have those symptoms occurring daily for 2 to 3 weeks, make that appointment with your doctor. The other thing, too, that you said that really resonates with me is you're putting everything else first, you know.
And not myself.
And women do that all the time. So you really have to be a strong advocate for yourself and see not just a doctor, but also the right doctor. You went to the emergency room. They referred you to us. I think I saw you pretty quickly.
It was 2 days later, October 13th, I was diagnosed. I saw you October 17th, and then the following Tuesday, on the 21st, I was having my first of 3 surgeries with you.
Right. So I think sometimes people don't get into the doctor soon enough, or they might go to somebody who doesn't even know about what a GYN oncologist is. So
I didn't.
Right.
Until I met you, I had no idea. In fact, I went to my family doctor. We were actually in the process of getting, I had an ultrasound done because I did have these symptoms. And I went to go see him. And as I was walking out the door, he said, you know what, let's just double check. Let's get an ultrasound. So when I was diagnosed by the emergency room doctor, literally 2 days later, I had my family doctor calling me back saying, I think you have ovarian cancer. So it all just came so quickly.
I think that's also a really important point to make, how you got the diagnosis. An ultrasound can sometimes lead to the diagnosis, but if you're having all these symptoms and your ultrasound's negative, you may have to push for something further, like a CT scan. I had one patient who she had an ultrasound. It didn't show anything because sometimes the ovaries can still be really small. You know, people can have something called peritoneal cancer that acts the same way. So the ovaries will be small, but yet they'll have this small volume cancer just all over the peritoneal cavity. And the peritoneum is that lining of the abdomen inside. So that's the other thing is go see a doctor, make sure you're getting the right tests involved. The CA-125 blood test can be helpful. If that's elevated and you have something on ultrasound and you're a certain age, then the likelihood of you having ovarian cancer can increase. And we're talking a lot about ovarian cancer, but you know, there's not just ovarian cancer, there's tubal cancer that comes from fallopian tubes, and then we mentioned the
So the CA-125 can actually do that also?
The CA-125 is a good marker.
For both?
It's a very non-specific marker, so if you have an elevated CA-125, it doesn't necessarily mean ovarian cancer, it could be other things. So if you have pneumonia or any inflammation, any itis, pneumonitis, hepatitis, those types of things can also cause an elevated CA-125. Fibroids can cause an elevated CA-125. congestive heart failure. So you have
There's
to be
a lot.
you have to
Okay.
be a little careful about how you evaluate it. But your story and how you presented and those signs and symptoms, combined with the abnormal ultrasound, definitely would have triggered the next step in evaluation.